Just last month, 20 people reportedly died from cholera following an outbreak of the disease in Bauchi State. The state's commissioner for health, while noting that the disease was found in 9 local government areas of the state, assured that measures have been put in place to contain the spread. By the 1st of June, however, the disease had spread to neighboring Plateau States with about 33 cases and 6 confirmed deaths in 5 communities in Jos South Local Council. As of 28th of March 2021, data from the Nigeria Center for Disease Control, NCDC, revealed that a total of 1,746 suspected cases, including 50 deaths, have been reported from 8 states that include Benue, Delta, Zamfara, Gombe, Bayelsa, Kogi, Sokoto, and Nasarawa since the beginning of 2021. Now, you may recall that the cholera outbreak of 2018, which recorded 43,996 cases and 836 deaths across 20 states, reaffirming the disease as a public health threat to the country. The big question is, why has cholera continued to reoccur despite several public health interventions aimed at preventing and controlling the disease in Nigeria? With the recent outbreaks in Bauchi and Plateau States, why now? What are the causes and how can it be prevented? Well, we have these questions and others with our guests shortly as we discuss outbreak of cholera on this edition of Nigeria Today. I'm Dennis Adegunloye. Welcome to the program. All right, with me in the studio to discuss outbreak of cholera is Dr. Basi Okposen, Director, Disease Control and Immunization, National Primary Healthcare Development Agency. You're very welcome to the program, sir.
Thank you. Good evening, Nigerians.
All right, let's just begin with the basics. Cholera, what exactly is cholera? How does it manifest and how is it acquired?
Okay. Cholera is an acute diarrheal illness of the intestines caused by the infection of the intestines with the bacterium Vibrio cholera. The Vibrio cholera is a type of bacteria. You know, we have several types of bacteria, viruses, and so on. Yeah. Once somebody is infected with it, and then it can come down with the cholera disease. And like you ask again, how does it manifest? Quite often, it is mild or without any symptoms, but it can be severe. 1 out of every 10 persons that comes down with the disease cholera have severe signs and symptoms of it. So you can see 9 will escape with either mild or no symptom, and then 1 out of every 10 from statistics. And what are those signs, like you've asked, that will let us know this is cholera? It's very, very clear. Watery diarrhea, what the medical people will call rice water stew.
Rice water stew?
Yeah, the water will just come out like rice water that you use in washing rice, just pure. We also see vomiting with force and then cramps on the legs. These are the 3 very common signs and symptoms of it. And then when that happens, of course, you know, when one is losing a lot of fluid from vomiting and the diarrhea, it leads to dehydration. From dehydration, the person can go into shock, if not rehydrated early. And then from shock, if not rehydrated, can lead to death, which is usually the most common cause of death when somebody is affected with cholera.
So is it contaminated water that we're talking about, or is there any other way that one can contract cholera?
Commonly, it is infection of water or food with the Vibrio cholera contaminating it, and then a human being either drinks that contaminated water or eat that contaminated food, that the person will come down with it. Though sometimes in the environment, like around the riverine area, the shelves of the shelf seafood, they now pick it up, don't cook it properly.
Yeah.
Those ones can also harbor cholera. But very commonly on the hinterland, like what you're seeing in Bauchi, Plateau, and a few cases also came up around Gombe. It's more of inland thing which has to do. Commonly, there are three main areas that this will come out from. We can have this infection. Number one, in areas we have inadequate and safe water for drinking. And in those kind of areas, you see for now it's rainy season. If somebody that has the cholera disease defecates, the rainwater will take this, wash it into the nearby stream or nearby well, and that water is not boiled. Anyone that drinks from that contaminated source will definitely contract it.
All right,
one. Two is sewage, fecal disposal, where the people are not having toilets, they practice open defecation. So it's easy there for the rainwater to just wash it, take it to the well or the nearby stream, and it becomes a source of contamination.
Sure.
And then thirdly, where hygiene is generally poor. You know, where the hygiene is generally poor, of course, these other conditions will come in. Place is not clean, no toilets, no kind of thing, no washing of hands. The person would have gotten a fruit and he didn't wash that fruit, just eating the fruit. Like now you see it's early rainy season, there are fruits that are coming out now. Those fruits might be contaminated and the person just take without washing it with clean water. So you can see it's not just an issue of Bauchi or Plateau that we are talking about. Even we that are in Abuja, the people in Lagos and the rest, like for the COVID, anything you want to eat, make sure you first of all, like fruit, wash your hands properly, wash the fruits that you want to take, and at least you can reduce the chances of getting infected.
Definitely, certainly, we have a lot to do with how we, preserve our health and protect the environment. All right, I'll come back to you shortly, but we are now being joined by Dr. Nimkong Allah, Commissioner for Health in Plateau States. You're very welcome to Nigeria Today.
My pleasure to be with you.
All right, just give us an update on... you're welcome. Give us an update on the latest in Plateau State. We understand about 33 cases and 6 deaths have been confirmed in 5 communities. Just give us the latest from your end there with regards to this cholera outbreak.
In Plateau State, just after the Salah break, we started noticing some sporadic cases of things that look like cholera. And we intervened immediately. And we thought it was something that we easily controlled, but we found out that it was affecting some local government areas. As of today, it has affected 7 local government areas in Plateau: Jos North, Jos South, Jos East, Baza, Riom, Barakeladi, and Bokos. So far, we have listed 365 persons with symptoms suggestive of cholera. And out of this number, we have been able to tested them with antigen rapid diagnostic tests, about 50 of them. We did culture for 4 of them. We are culture positive, confirming that yes, we are dealing with cholera. Of this number, we have been able to discharge 340, and we lost 6 people. So looking at our case fatality is about 1.6%. So far, that is the update from Plateau.
All right, and what is the general mood there in those local government areas where these outbreaks are happening? What are the people there saying, and what are their feelings generally?
Yeah, when we noticed this, immediately we saw into action. Our risk communication team started going around because we know the route how this cholera is being obtained. So we started educating people using our open vans to educate them on their personal need for personal hygiene, environmental sanitation. They should also make sure that any food that is left, they should make sure all their foods are closed. They should not leave food that are outside. And if they have fruits they must eat, they must wash. Even if they say they have washed it, they should wash it again before eating. Because that is very important. Without those ones, we are going to have more problems. So a lot of health education has been going on in this local government, especially the Jos North and Jos South. We did a lot of health education to the people. And I think one fortunate thing is that most of these cholera cases are self-limiting. So we are able to take care of them with the fluid, oral rehabilitation therapy. Very serious cases, we have to use IV fluids. And the one that needs more serious, we have to give them other drugs. Drugs like doxycycline, we are also giving to serious people that had fever and they were on admission. But most of them have survived and gone back to their families.
All right, that's good to hear. I'll come back to you very shortly, Dr. Nimkong. Let me come back to our guest here in the studio. In terms of vectors, how this cholera disease is transmitted, what are the vectors? Is it flies, and what are the potential hazardous vectors are we talking about?
Okay, in outbreaks like what we are seeing, the commonest source of this contamination is feces of an infected person.
Okay.
That has the bacteria, Vibrio cholerae. So that one person alone can contaminate the entire environment.
Right.
So when that goes out, the person passes it in his stool, in his or her stool, and then it goes either into water, or flies also sit on the feces. Like I mentioned earlier, where we have poor fecal disposal, the flies can pick on this bacteria to contaminate fruits, food, and the rest things. And of course, at any point an individual drinks this contaminated water or takes this contaminated food or fruits and ingested into the body, the person gets infected with the disease, and that is how it's transmitted.
For sure, and definitely this drive by federal government to end open defecation certainly cannot, the importance of it cannot be overemphasized. All right, we'll take a short break. This is Nigeria Today. Stay with us. We'll be right back after this message.
Do you know that cholera is a waterborne disease that causes acute vomiting and stooling in patients and can be gotten from infected water and food? It is so dangerous that it can kill if not properly treated, but also can be prevented. Stay healthy by always washing your hands and food regularly with clean water before eating. Drink clean water and also practice safe hygiene. Use latrines and do not defecate close to rivers, stream, or any water body. Cook your food very well, especially seafood, and also wash your fruits and vegetables with clean water. Also, take the oral vaccine from any of our healthcare workers whenever they come to your area. Quickly administer oral rehydration therapy to patients before taking them to the hospital. Keep your environment safe. Keep your family safe from cholera. This message is brought to you by National Primary Healthcare Development Agency and partners, and powered by Gavi.
Right, welcome back. The program is Nigeria Today. If you're just tuning in, we are discussing the outbreak of cholera. We have in the studio Dr. Bassi Okposon, Director of Disease Control and Immunization at the National Primary Healthcare Development Agency. And joining us via Zoom is Dr. Nimkong La, Commissioner for Health in Plateau State. Dr. La, just give us why you think this is happening at this time, this outbreak of cholera. What is, in your view, is the reasons why we're seeing this outbreak now?
This period of time for us, I think Nigeria as a whole, this is the period that is a bit humid, and we have a lot of flies all over the places. So, and then people have fruits. You go around, there are fruits in the market, mangoes, some garden eggs, some of those things are so people eat raw, available in the society. And as such, people use those things without washing. And you know, for one person, if one person has cholera, and care is not taken, it can spread to a large community of people. Because he may just pass through and he flies, lice, or those things, pick them, and fruits are laid all over, person taking it and eating, then there is likelihood that cholera will come up. So it has been, it's a recurrent episode. Within this period of time, we tend to have cases like cholera.
And you said earlier that there's been some sensitization in those local governments in Plateau State on preventive measures. Just elaborate a little bit more for us on what you're doing. You said earlier that there's been some sensitization drive in Plateau State in view of what is happening now. Just elaborate a little more for us on what you're doing to sensitize the people on what they can do to prevent contracting cholera.
Yeah, I thought we started sensitization, telling people about what cholera is, how it is transmitted, what they should do, and tell them that this is the period in which they should expect these things. So they should make sure that they take care of their hygiene, environmental sanitation, very important for them. Make sure their food is not left open. Make sure they should wash things that they eat raw without necessarily cooking. And they should cook some of those things before eating. If it is a food that is left over open, they will have to make sure it's recooked or boiled well before they should eat. And a lot of them are taking that one very seriously at the local government. So I think we are on the side that some of the cases are reducing now. So we think that the sensitization we are doing is taking into effect and people are taking care of it. So a lot of cases are coming down, not like some 2 days back when we have COVID. In particular, today we had, the whole state, we have only 25. Unlike a day yesterday and the day after that, we have 50, 60 of those ones. So the numbers are coming down. So we think our health education is working.
All right, that's definitely good to hear. All right, Dr. Bassi, is there a particular category or age group that are more prone or vulnerable to contracting cholera, or is it indiscriminate?
You can catch anybody, and then the state of the person, the general state of the person will again now contribute to the manifestation of it. For instance, somebody that has the low immunity, who cannot resist, of course, will definitely manifest more. And like was mentioned earlier, we have more of, often is mild or without symptom, but those people that are the vulnerable, the very young, the elderly, and then those that are immunocompromised and with poor nutritional status can react more and have more severe sicknesses than a normal well-fed person.
And in terms of reducing fatalities, what message would you have for those out there who might fear that they are contracting cholera? You say there's mild symptoms, and what can people do to get treatment as early as possible?
Before talking about what we can do to reduce the fatality, I will first of all advise Nigerians. The popular saying, prevention is better than cure. It's good we stay safe. That staying safe, let's do simple things like ensuring that we have adequate and safe water in our household and neighborhood. If we are picking water from stream or other sources that we know are not safe, let's do the simple thing, act of boiling that water, making sure that that water is boiled before, allowed to cool before being used. We take care of our food, making sure that our food are properly boiled, and then when we're not eating it, they are properly covered. Before we eat this food, we wash our hands very well. And then we ensure that our environment are clean so that we reduce flies. Let's ensure as Nigerians we don't practice open defecation. Let's have toilets, have places where we bury this excreta that they are not exposed to flies. Now we're in rainy season. It's very common. Once you do open defecation, rain comes, it will pick this. If there's a nearby stream or a well that is not covered, it will contaminate it. So as Nigerians, let's stay safe, keep our environment clean. And then for the fatality, reducing it, if someone comes down with the disease, one of the early first steps that is usually taken or we must take from the household is to ensure that we prevent them being dehydrated. As diarrhea is starting, we give them enough fluid. We start with the ORS, which is very common, the oral rehydration therapy that we give even to children, the salt sugar solution. We start with that, and where it does not, the diarrhea is not controlled on time and the person is beginning to be dehydrated, we use the drips to be able to replenish the persons. These are the early stage because it is the dehydration that most times causes the problem for the patient to go into shock. So we have to prevent that. And then in severe illnesses, that is when you now add antibiotics when you want to prevent other complications coming in.
Absolutely. All right, Dr. Nimkong, let me come back to you. Give us your final remarks, your words to members of the public there in Plateau States and generally in Nigeria as to the situation as it is now. Surely there's no cause for alarm or panic, but there's also need for caution. Just give us your words of advice to members of the public.
So, the people of Plateau State and Nigeria at large, cholera is a disease that is preventable. It's also treatable. So people should not worry so much, but we should focus more on the prevention so that we will not have it on the plateau again. I said since he has claimed 6 lives, and that is not that is a serious issue. So people should take it seriously, follow the guideline for prevention, the one that I've mentioned. They should take it very seriously so that we will not get this cholera again. Things that have to do with their environmental sanitation, people should have toilets in their, we shouldn't have open defecation. So our advice, every household should have toilets that they should use. They shouldn't go and practice open defecation because that will even cause more problem to us. Rainy season is around. And
All
if
right.
people are going to use water that is not safe, then it will become a problem. The other issue is that government should make provision, potable water available for people.
Definitely.
People can use. And
All right.
the simple standard prevention.
Okay,
Thank you very much.
Thank you. Sorry to cut you in there. Our time is up. But Dr. Nimkong Lau, Commissioner for Health, Plateau State, thanks for taking the time to be with us on Nigeria Today and sharing your thoughts with us. And good luck as you continue to battle the outbreak there in Plateau State. Thank you very much. And thanks to Dr. Bassi Okposon, Director of Disease Control and Immunization at the National Primary Healthcare Development Agency. Doctor, thank you very much for your expertise on this topic.
Thank you.
And thanks to you out there for watching. Nigeria Today is live every weekday at 7:30 in the evening. Also watch this and other editions of the program on youtube.com/NTA News 24 Hub. I'm Dennis Adigunloye. Many thanks for your time.